Greetings, everyone. Welcome to True Health Live. Today, it's our second episode, season 3, episode 2, and we're talking about emergency preparedness. And emergency preparedness, not just in the context of public health, because it's an integral part of public health, right? But more so in the context of like how we respond to disasters. So that is, kind of the premise behind today's show. And I won't keep you long because as you can see, it's just me. So we're just going to have like a quick conversation. So as you come in, if there's comments and questions, just let me know. And I'm happy to have like a nice, full, robust discussion with some of you viewers. And even if you're catching this after the fact, make sure that you like, share, and subscribe. Leave comments for True Health Live. And because I always like to engage with anyone who's watching, and there have been some comments, and I love to like respond to them. So let's just get into it. So what is EP, or emergency preparedness? And it's the actions taken to, prepare for and respond to natural disasters, man-made disasters, any kind of public health emergency, or any like unexpected event that does require a response, and because they pose a threat to us, right? Public health. So whatever planning, training, resources to effectively respond to emergencies and, address the impact that they might have. So what does that mean? It means that people who are in the field of emergency preparedness have to have some sort of knowledge and do some sort of risk assessment, so if a given thing may happen, like what is the risk to the population, or, what would be the incidence of, people getting hurt, or, how do we do that? What would be, a potential outcome of things happening, which we'll get into. And that definitely means that you have to plan, right? So not just like thinking about like, what the risk assessment is, but part of that is planning. So those of you who are also knowledgeable of any sort of like project management planning or project management professional, those who have your PMP, that definitely goes along with emergency preparedness. You definitely have to be, detail oriented, so you can make sure that you're looking at all the different pieces, moving pieces and facets of any sort of emergency plan. Oh, I sound a bit scratchy. I think at this point, it is probably just the StreamYard potato chip monster. So willfully, we'll move through it. I'll try to see if maybe I can remove myself from the stream and then come back. Let's see how this might work. Let us see. Okay. All right. So maybe willfully that worked a little bit. Just let me know. And peace, Bernice. Thank you for joining. So back to what I was saying, we're talking about emergency preparedness. So there's, risk assessment. What is the risk of a given natural disaster that may happen? So if you're living in an area that's prone to certain incidences like earthquakes, you have California, places that like Turkey, that recently experienced that 5.0 magnitude earthquake, but they actually do have a history of earthquakes. They had a 7.0, I think, either 2022 or 2021. If you live in an area that's prone to flooding, so these are the parts, that are taken to effect. So then there has to be some sort of emergency planning behind it. And that's based on the risk assessment. And they're developed to help people, and communities prepare for what's to come. And there are things that you may not be able to prepare for, especially given what we're seeing with climate change, right? Or man-made disasters. So examples of that are, the snow in California. You have people, this is an area that is not necessarily used to the level of snows that they've seen, if at all. And there were people trapped in their homes. There are people who have died, as a result of not being prepared for that type of emergency. And so this is where it becomes crucial that, cities actually talk to one another. How do we, respond? Like, how can we liaise with a place that is used to this type of weather? How do we do that? And so there, not to say that there isn't that kind of movement, but, that's why it's important, for those things to happen. And yes, unfortunately, you cannot be prepared for everything. But again, based on how we're seeing the world move and we see all of the different shifts in weather with climate change, our natural disasters are actually going to be things that are, and you can even say, because of the things that we're doing to influence weather, it is possible that some people may not want to call it natural disaster, but for purposes of explaining, and talking about this today, what we see in climate change, there are going to be more frequent natural disasters that we see coming up, especially when it comes to weather, like the snow, the flooding, etc. Another example of like man-made disaster, the chemical leak in Ohio with the train accident. So that's, man-made, that because that was caused by humans. So that's an example of man-made disaster. And so what's really crucial when it comes to like the emergency planning, which is based on the risk assessment, is it's the response. So that is the real crux of emergency preparedness. How do you train emergency responders such as firefighters, paramedics, police, any medical personnel who are able to respond quickly? This is why it's also crucial that even you in your home, like how prepared are you to deal with a natural disaster in the event that you're in a space where maybe those trained emergency responders cannot get to you soon enough. So have you really taken inventory of your home and yourselves and your own skill set to make sure that you're keeping yourself safe and healthy, right? So this is where we can even get into, preparing to bug out, if you will. So if you have to leave your house, like what is your own personal or your family's disaster response? Do you have first aid kits in the house? I know it's scratchy. Is it really scratchy? I'm not even sure if we can fix it. I could try the Nintendo cartridge. I could try the Nintendo cartridge. Blow it in the iPad, but we don't even know what that might sound like. You're probably hearing me. Let's see. I'm gonna try it again. And you let me know if it. All right, so good evening. Peace, Shibuya. Thank you for joining. Peace, top tier speakers. So as I said, I'm not going to keep you guys long. So we're talking about emergency preparedness, so disaster and preparedness, or preparedness in public health. I think that's what the title says. But we're talking about it with the context of being prepared for natural disasters, man-made disasters, and some of them being a result of climate change and how we kind of see that happen in the world today, right? And so some examples that I brought up were, the snow in California, places that don't necessarily see that level of weather or that type of weather in that area. So, there's not necessarily maybe a emergency response plan for that because this is not an area that typically experiences that. But then it's like, what about the areas that do typically experience some natural phenomenon like earthquakes or weather, flooding, and things like that? So are you aware of what your communities or your city, municipality, what the emergency plan is? And if not, do you have one personally for yourself? Whether that includes bugging in, bugging out, what you have in the house, and also like how prepared are you if you're not able to if you're not in a space where trained emergency responders, police, firefighters, medical personnel can get to you in time. What's your skill set? How prepared are you to keep yourself and your family safe in the aftermath of any sort of natural disaster, man-made disaster, etc. So some of the things that we went over when it came to what is emergency preparedness, that is, it is definitely, I'll repeat it for those of you who have joined us. It is, the actions that we take to prepare for and respond to things like natural disasters or public health emergencies, right? And other unexpected events that pose a threat to us. It involves planning, training, and resources that are used to effectively respond to these emergencies and, mitigate or reduce the negative effects of any of these events. And so some pieces of that are things like risk assessment. Again, what kind of area do I live in? What is the risk of a flood? What is the risk of a snowstorm, a crazy blizzard? What is the risk of an earthquake? Emergency planning, which is based on that risk assessment. Developing your evacuation plan, identifying emergency shelters. So again, are you in a space where you can easily access these places that may be provided for residents in a given area? If not, have you figured out how to create that or locate that for yourself, right? What are your communication channels? How will you disseminate critical information to you or your loved ones if you're not necessarily in the same space? Do you have a meetup point, right? And then the disaster response. Emergency preparedness also involves like training of the emergency responders, like I said, police, firefighters, medical personnel, etc. Then there's the community education piece, which is kind of what this is. How are you educating? Peace, Marjorie Marie. All right, thank you for joining us. Oh, that's so sweet. So, how are you preparing to evacuate safely? Do you and your family know what the community guidelines and exit strategies are? Are you aware of that? If not, have you created it for yourself, right? Emergency preparedness, as I said, it's essential in reducing impact of negative effects of natural disasters. So let's kind of dig in a little bit to natural disaster. You can use the Google. Catastrophic event caused by natural phenomena such as extreme weather conditions. We touched on that earlier. And we can say climate change has introduced a lot of extreme weather conditions, especially in places that are not used to certain weather types, like insane blizzards that have locked people into their homes and blocked roads in California, in a place where that doesn't necessarily see this. I was speaking to a sister a few weeks ago, and she lives in a section of California that doesn't typically see snow, but it was snowing. It was like big old flakes. So this is very indicative of climate change, and where you're seeing extreme weather conditions, geological disturbances. So that would be like your earthquakes, right? And earthquakes can cause tsunamis. Tsunamis can flood cities, and it can, back up sewer systems, contaminate water, depending on the things that have now been kind of all mixed up in a cesspool because the water has, damaged everything. It can ruin infrastructure, city infrastructure. Great example is the earthquake. Infrastructure, roads. Taking Haiti, for example, the earthquake that they experienced, it really took away, and especially in a place that already is struggling with, as a developing country, right? And already struggling with infrastructure, it really kind of took things down. So now there's, now we have to kind of start almost from ground zero to build up infrastructure again. Fix the roads, fix houses that have literally collapsed. In Turkey, they have, the government actually started to look for the contractors and the builders and the architects who are responsible for some of the buildings that literally just collapsed. I mean, don't get me wrong. There is another piece to that with regards to what are the materials that you use? Who inspected this building to say that it was safe? And, did you have, checks and balances in place when it came to making sure that it could withstand earthquakes, especially if this is a region that does experience earthquakes. So these are some of the things that we have to think about. So moving on about natural disasters, hurricanes, again, that is weather. It is extreme weather condition. Again, it can be something that, some might say is climate change, but hurricanes have been around for a very long time, but we are seeing an increase in intensity and frequency. So these are things that we have to watch out about. Tornadoes, floods, wildfires, landslides, sinkholes. There's so many people who have experienced the entire, their home literally being swallowed up by the ground. There's an area in Israel where the shoreline is literally sinking into the ocean, so nobody can actually go there. So these are things that are happening. Natural, spiritual is up for debate, but these are things that are happening in the world. They can occur anywhere. Some of the things that we do see as a result of natural disasters, injuries. And so this is where, a lot of the public health piece comes in, and making sure that you're absolutely prepared. Injuries. Earthquakes cause so many injuries. How many times do we have to, we're looking at the rescue and response, and there's people trapped in rubble. Hurricane Katrina, people trapped on their rooftops without water. Things like that. It causes they're also like they're being burned by the sun because there's nowhere to go. There's some people can't swim. So these are things that really perpetuate injuries, even infectious diseases. Peace, Master Manulet. Nice to see you. He says, yes, hurricanes are right. You're right. You live in like the hurricane heartland, right? No joke. Double trouble if there's extreme flooding involved. So like this is why it's important to know your rendezvous points. Where are you going if you're hitting? If something is happening. Where it's a natural disaster, man-made disaster, like, what is your rendezvous point with your family? Do you know what is offered by your city? Does your city even offer anything? These are really, really important things to know. And they are absolutely part of public health. Again, infectious diseases. Natural disasters in particular can cause displacement of individuals, their homes, communities, and so that increases the risk of infectious diseases. If you're on medication and maybe your medication was left at the house, you don't have any stash with you, and especially let's say you have sort of issue where your immune system is compromised or easily compromised. This is where you're, very prone to infection. Some people are just prone to infection. And it also can happen when it comes to waterborne diseases. So think about the flooding, right? What's being mixed all up in this, in this water. Water can carry a lot of different diseases, waterborne diseases. And so that's where you get things that are infectious. Because what are you using to drink? How is your drinking water being contaminated because of any sort of flooding? Yes, the swim part, right? Because of any sort of flooding. So when it comes to natural disasters and infectious diseases, especially in developing nations, and it doesn't mean that these things cannot happen in developed nations like the UK or countries in the UK, because it's the United Kingdom, or the United States. But diseases like cholera, typhoid, hepatitis, these are things that are really there are a risk for people, especially when it comes to contaminated water and other things. Those are just like to name a few. Displaced people may also, be more exposed to, contaminated food. Again, it further increases the risk of infectious diseases. Another really, really, really crucial part: mental health. Natural disasters can cause significant stress and trauma, and they can have a long-lasting effect. You don't have to be, and I'm sure a lot of people know this, but maybe some don't. You don't have to, have been seen active duty, like you have been enlisted in the military to experience post-traumatic stress disorder. Many different things can cause us to be traumatized and be experiencing post-traumatic stress. And things like losing your home, losing family members as a result of a natural disaster or even a man-made disaster can cause a lot of stress and also create, bring about PTSD or post-traumatic stress disorder, depression, anxiety. These are all common health issues that can be exacerbated by experiencing and kind of living through any sort of natural disaster. Does it mean that emergency preparedness will stop that? No. But again, being prepared or understanding emergency preparedness can reduce or mitigate negative effects. So if you have a plan in place, or even after watching this podcast, you're listening to this podcast and watching the live, you can really it inspires you to create your own emergency preparedness plan, because it is, again, a crucial part of public health. You don't and shouldn't have to wait for the city or the municipality to tell you what to do. Talk to your family members. Just make a plan, and I'll put in the chat, in the description, a great video that you can watch by Chief Yuya that talks about the things that you should have. It literally lays out step by step the things that you should have for bugging in and bugging out, because these are crucial pieces of public health. So other things that might happen: chronic diseases, and this is a big one. If you have a chronic disease, most likely, most people, do use conventional medicine or allopathic medicine, where they see a doctor, they're probably on medication. If you're in a space where you have experienced or experiencing, natural disaster, man-made disaster, where emergency preparedness plans are in effect for you, right? Having chronic disease or having an issue where you have to take medication is something you definitely want to think about, right? Can you sit, and this is key, can you sit with your doctor or whoever your medical professional is, whether you see a physician assistant, family nurse practitioner, and come up with a plan that either kind of weans you off if you do have something that you're able to be weaned off of medication, or figure out alternative methods, so that if you are ever in a situation where you don't have access to pharmaceutical products, that you know what to do for yourself in order to address your illness. And again, this is why I say speak to your medical professional, but it definitely is a part of public health, because there's so many people that they're kind of out on a limb, or maybe out on a limb because they are kind of stuck or beholden to having to take medication, all the time. So if something should happen and the medication is not accessible, bad news, right? I'm going to go to the chat real quick because I'm seeing a lot of chatter. The water table in Freeport was full of salt for months following Hurricane Dorian. There were so many people unaccounted for that the mental health strain was very widespread too. See? Absolutely. What happens when we have a missing family member, from a flood, or missing family member that may have been near the fault point or fault line of an earthquake, or near where the damage was, highest. In a city that has experienced an earthquake. Even think about man-made disasters. We think about 9/11. How stressful that's a man-made disaster, right? So how stressful might that have been for family members for people who had family members that were in the vicinity, whether they were unfortunate and perished or not. Some people came home, but they were never the same. So the post-traumatic stress and the mental stress and the mental health is really important when it comes to emergency preparedness. And that's more speaking to the aftermath of a given situation. Margie Marie R says, are there example templates available? Do you have a recommended site? I don't have available templates, but what I'll do is I will locate some and I will put them in the chat. And I'm imagining you're talking about well, that's a lie because I just gave you the video. you asked for templates like for yourself. So I would say, which I will put in the chat. What I would say is, you can definitely look at Chief Yuya's video when it comes to like how you prepare for bugging in and bugging out. And there's so many people who are into emergency preparedness for their own families, like YouTube University, plethora. But I'll definitely put the ones that I recommend in the chat, in the description box after this live. I caught the recommendation right, okay, because I'm a little bit behind in the chat. Master Menulex says many people were forced to their rooftops and needed to be rescued by people riding jet skis through the streets. It was chaos, and there was a lot to consider after that disaster. Absolutely, you're very welcome, Martin VR. Absolutely. Which brings me to environmental hazards. So natural disasters and man-made. We're just going to say disasters, right? Unforeseen disasters. And unforeseen does not necessarily mean that it was unpreventable, because I think sometimes things can be unforeseen, but when it comes to some things, if we are doing the risk assessment, right, and have like well thought out plans in place, they can be unforeseen, but like not unpreventable. Or even if it is foreseen, you can have a really good plan in place, to help. And when I say things being unforeseen but preventable, maybe that, that goes with the climate change and the things that are happening now 10, 20, 50 years down the line because of things that we've been doing for 50 years, right? So environmental hazards, toxic waste, mold, air pollution, how much mold, especially when it comes to floods, right? Once that water subsides and goes down, there's so much damage and things may be allowed to sit for so long, then we have mold, right? If you are a homeowner, you live at home, regardless if you're a homeowner, black mold is the one thing you do not want. As I say, mold, air pollution, right? Negative impact definitely on public health, because these things can have a really negative effect on our respiratory system. So then that gives us, different issues, allergic reactions, et cetera, et cetera. So overall, any kind of disaster, I'll say, not just natural, but man-made as well, they have a significant impact on public health. So that's why it's important for us to have emergency preparedness plans in place and take steps to mitigate these effects. And some of the things I wanted to talk about, and some of you have hit on it in the chat, I was thinking what are the main causes after natural disasters? And so some of the most preventable things are, they vary. They do vary depending on the type of disasters, but they generally include, as we went over earlier, waterborne diseases, lack of medical care, inadequate shelter, food insecurity, mental health issues, right? So all of those things we just talked about. So when it comes to waterborne diseases, depending on things like hurricanes that might bring on floods, or earthquakes that might bring on tsunamis, what are the water sources that are being contaminated due to bacteria and viruses, which do spread, and that's what leads to waterborne diseases, cholera, typhoid, things like that. Medical care, right, in the aftermath. Are you in a space where maybe the trained first aid responders or the emergency preparedness responders can reach you? If not, maybe you don't have a plan in place, and most people don't. Do you have a personal or family plan in place to get you the medical care that you need? Or do you have trained individuals? Do you have a meeting point or someplace you can go where this is your crew, this is your group, and you have all the different personnel and human resources that are key for your group's survival. Adequate shelter. So inadequate shelter is one of the main causes of death in the aftermath. Do you have an adequate shelter place to go to? And sometimes you may not. So have you gone and looked through any type of training that you can get in order to find adequate shelter? And some of this goes with, learning how to bug in and bug out. Do you know how to forage? Do you know how to, and not just forage for food, because, when we talk about foraging, it is food, but do you know how to seek out shelter that will be adequate enough to keep you safe from the elements and sometimes other people? That's just a reality. Greetings, Akuya B said, welcome, welcome, welcome. Margie Marie Arsa says, this also makes me think about when people have loved ones in healthcare facilities and they have to separate from them during natural disasters. Yeah. And one of the things that happens with healthcare facilities, it's a scary thing is when the power goes out. And yes, they do have generators, but they require a lot of power, especially if it is a place where they do have a very an intensive care unit or babies even on respirators, and people who are using the machines, to breathe, to exist. So this is where it is really key to think about some of these things, how are you moving? But yeah, it still can be a scary thing if you do have a family member that might be in a healthcare facility and they're in no condition to be moved. Those are some of the things to think about, how do you prepare for that? Because that may be, you have to have some mental preparation, right? That's just realistically speaking. Master Manuelek says, I'm sorry, Marjorie R says the facilities have their own process for these. Yes, they absolutely do. But again, as a family member who's not, admitted, you want to make sure that you may want to what is it that you can do to mentally, you may not be able to mentally prepare yourself. There's nothing that can prepare you for certain things. But how do you do self-care afterwards if this is something that you have to go through, right? Master Menelik says, don't forget the looting. Right. Don't forget the looting that can also occur during the aftermath of these disasters. the looting for food, and also like, because we talked about people who are suffering from chronic diseases who might be like, in a space where they need medication because they haven't figured out like alternative plans. So the looting of pharmacies and food places, understandable. But the looting of places where it's just material things that may not even work anymore because there's no power, like, I never understood it. But you are exactly right. You're absolutely right. Don't forget the looting that can also occur during the aftermath of these disasters. When people lose most or all of what they have, we see how deep their morality truly goes. Absolutely. There's a really good film that is good to watch, especially. So this is another resource. So especially for those of you who are looking, like, you want, it's a good example of what the importance of being prepared and having your plan in place, and it's called Survival Family. It's a Korean film called Survival Family. So I'll put in the chat where you can find it, because I honestly can't remember where I watched it, Netflix or whatever, but I'll put in the chat where you can find it. But it's a really good film to watch, and gives a really good example of why your family should be prepared for any type of disaster. You can definitely think about like, what are some of the things that affect the area that I live in, but what are some things, especially given how the world is moving today, when it comes to climate change, when it comes to like, anything, how can we move? There's a lot of nuclear testing going on. Okay, so what does that kind of preparation look like, right? Bomb shelter. I don't know. So peace, Akria. So those are the things that you want to think about, because, and especially when it comes to shelter, because inadequate shelter could also even lead to things like the waterborne diseases and the food insecurity if you didn't necessarily like pack your food away. Bugging in, like, what is the supply of food that you have? Because these are definitely, we call it bugging in and bugging out, but these are definitely part of emergency preparedness plans when it comes to natural or man-made disasters or anything that's unforeseen, right? What are your stores? The stores that you have in place when it comes, how long will your stores last you? Is it enough for one person? Is it enough for a family of 2, 3, 4, 5, 6, 10? And if that's the case, like, have you thought about like, how you're fortifying where this is? Because as Master Mia like said, when people lose things, you can, and things, when what is the acronym? I don't know, when the SHTF, when SHTF, how are people really going to act? And so all of this is actually key to being, having your own personal emergency preparedness plan, or knowing what the emergency plan is, for wherever it is that you live. So in summary, making sure that you have that emergency preparedness plan. You've done a risk assessment. You know what your disaster response is. And I'm talking both whatever it is for the city you live in, and you have a personal one for you and or your family, is key. Knowing that these are the things that you'll have to run into. Like, what are the things that you're preparing for? Making sure that you're not going to be prone or susceptible to some things you may not be able to prevent, but the emergency preparedness plan will mitigate or reduce or even eliminate things like injuries, infectious diseases, chronic diseases. The mental health, that requires like a lot of self-care and doing things where you can, learn how to be more mindful, intentional, and what your response is to certain things. It will mitigate your, chronic diseases, environmental hazards, and then knowing what the things are to watch out for. Waterborne diseases. Do you have adequate medical care? What are your human resources for the people that surround you when it comes to what's needed? Are you around people who are, emergency response trained? Do you have adequate shelter? Do you have food stores so that you can reduce your susceptibility to food insecurity? So those are some of the things that I wanted to talk about today, since it is just me. So yeah, because the emergency preparedness is a really, really crucial part of public health, because yes, it reduces negative impact of natural disasters on individuals, but I think it's a piece that just the public, maybe public health professionals are very aware of. and keen on the importance of emergency preparedness, but how many individuals of Jane and John Q. Public are really tuned in to the need for emergency preparedness. We hear what's happening on TV, right? You'll hear reports, FEMA this and this person's doing that, but how much of it are you actually understanding? Like when they tell you like what the pitfalls were, what somebody did wrong, do you actually understand? Wacky the end. T.O. Twaki. Do you actually understand what's going on? Chief U.S. says, or T.O. Twaki, the end of the world as we know it. Hey, I don't want to say it, but be prepared, people, because some crazy things are happening. So part of being, that your public health, your personal and public health, is having that emergency preparedness plan, understanding what emergency preparedness entails. Marjorie Marie R says this was an important topic to shed light on. We don't even think often about it. Give thanks, because that is the whole purpose of True Health Live. Like we try to have fun and talk about things that, in a way and from a perspective that isn't necessarily talked about, which sometimes can be difficult, especially when you're in the we're in cancel culture mode right now. Everybody's being canceled if you say something wrong. But honestly, this is my show, so I'm gonna say it. Like I'm gonna say it. But again, True Health Live is also about information, because it is about providing people with information and the tools to make informed decisions about their health. So every now and again, we will do a show where we're providing like some tips and tools that people can use that do help with their own personal and public health. So give thanks, everyone. Thank you for allowing me this time to like come in and have like a quick share with you and talk about something that is very crucial to public health. And hopefully you like, share, and subscribe. Make sure you share this with people you know. You can listen to the podcast. It will be uploaded this evening and available for listening, your listening pleasure. And you can also rewatch and replay these videos as you choose. And again, I will put all of the resources that I mentioned regarding the bugging and then bugging out videos by Chief Yuya, as well as the film Survival Family. I wanted to say Korea and family at the same time, which is a Korean film. So it does have subtitles, but it is a really, really good film, and I encourage everyone to watch it. So peace, everyone, and I will see you in 2 weeks. True Health Live is live every other Tuesday, so Tuesdays at 8 p.m. So you will see us next on April. I'm so bad at my dates. I didn't look at the calendar. Not next Tuesday, but the Tuesday after. I'll put it in the description box. Peace, everyone. Bye.